Hi there, I'm Dr. Jennifer Scoles, and I just want to say thank you so much for choosing Scoles Family Chiropractic for your chiropractic care. Today's appointment is the most vital appointment you'll have in our office. We're going to talk about what chiropractic is, how it can help you not only feel better, but function better as well. And today's appointment will also be the last long appointment you have in our office. From now on, your appointments will actually be about 10 to 15 minutes, and we like to get our patients in and out of the office as quickly as possible while giving you excellent service. So Dr. Andy's going to talk about some amazing things that's going to help you not only today, but long-term as well with your health care, because we believe that we shouldn't just go over your findings and say, okay, this is what you need to do, and you just need to follow our directions because we said so. We want you to understand why you're here and how chiropractic is helping you function better. We're going to give you a little sheet of paper. It just has some questions on it, an area for you to ask any questions. If you think of something while Dr. Andy's going over the information, write it down because most likely you'll forget it later. There's also a section here that has names and health situations. So if you think of someone while Dr. Andy's speaking about maybe someone who has fibromyalgia and you think, oh my gosh, chiropractic could help them, be sure to jot their name down real quick so you don't forget that as well. And we also do free health talks in the community, so if you think of somewhere while you're listening to this that could benefit from this information, just write that down and we'll be sure to give you some information about those talks that we do. So I hope you enjoy the doctor's report.
Hi, I'm Dr. Andy Scoles. I want to welcome you to your doctor's report or new patient orientation. The word doctor actually means teacher, and so we like to take a few minutes and teach all of our new practice members how to take better care of their spine, and ultimately how to take better care of their health. Hippocrates actually said, look well to the spine for the cause of all disease, and he really knew what he was talking about, because your spine has to control every function in your body below your head. You've got about 100 billion nerves that pass from your brain, through your spine, out to every single cell, tissue, and organ in your entire body. So in order for your heart to beat, for your lungs to breathe, for your muscles to move, your brain has to be in constant communication with the rest of your body, and it does so through your spine. So you can think of your spine like an information superhighway. Think of it like Interstate 40. When all the lanes are open, that's great. Traffic's going to get from point A to point B like it's supposed to, and everything works properly. But sometimes with a highway, there can be roadblocks, right? Same thing with your spine. We call those vertebral subluxations. When one or more of your vertebrae move out of alignment, it puts pressure on one or more of your nerves, and then it stops that communication between your brain and wherever that nerve's going to. So if that's a nerve going to a muscle, that muscle could be weak or not working properly. If that's a nerve going to an organ, whatever organ that is, isn't going to work as well as it should. So that's what we're always looking for as chiropractors. Now, one of the things I'd like for you to start doing is thinking about your health maybe a little bit differently than you have in the past. Most people think of health as feeling good, and maybe they wake up in the morning and they don't hurt or anything, so they think, well, I'm healthy, no reason to do anything about my health today. If they do have symptoms, they think, well, maybe I should do something about it. In reality, if you look up the definition of health, it doesn't say anything at all about symptoms. It'll say something along the lines of being healthy is a condition in which all of your functions of your mind and body are totally normal. And so that's what we're always looking for. You may come in here with neck pain, back pain, carpal tunnel, headaches. Those are some pretty common things that people come to the chiropractor for. But what we're really looking to do is restore that normal function in your body. We know that if you're functioning properly, not only are you going to feel better, but you're going to be healthier too. But symptoms, pain, is like an alarm. It's a warning that, hey, there is something going on, you better do something about it. So if you were to have a fire in your house in the middle of the night, that fire is going to set off the alarm. The alarm warns you, right? It's telling you what's going on. You wouldn't want to call the fire department, have them come rushing over, and just put out the alarm. That's the thing that warned you. It's the thing that woke you up. But if you did that, your house is going to burn down. Unfortunately, this is what most people try to do when they first have symptoms. Their first instinct is to maybe run out to the pharmacy, grab some over-the-counter painkillers, and try to mask those symptoms, all the while their house is burning down. They're getting more and more unhealthy. Obviously, what we want to do in this case is take care of the cause of the problem, and then that's going to silence the alarm. So that's what we're always looking to do in chiropractic, find the cause, correct that, get things functioning properly. The other reason we don't want to just throw painkillers at our problems is even the over-the-counter ones are not very safe. I'm not going to read this whole thing, but this is a study from the National Kidney Foundation, and it just says that the chronic use of a combination of acetaminophen, which is just Tylenol, and aspirin, such as that found in brands like Excedrin or Motrin, is so dangerous that it should not be sold over the counter. In fact, it's so dangerous that between 8 and 10% of chronic kidney failure can be attributed to the overuse of these combination analgesics. We've seen this. We had a patient come in. She was in her 50s. She'd been having some low back pain and taking Motrin for it. She started getting adjusted and her pain went away, but by that point she had kidney failure. Unfortunately, her medical doctor said, yeah, the kidney failure is due to all the Motrin you've taken over the years. Another study I read said if you take 1,000 regular strength ibuprofen tablets throughout your lifetime, this is cumulative, you start to do irreversible kidney damage. So 1,000 sounds like a lot, but I know people taking 3, 4, 5, 6 of those a day. So in 6 to 12 months, they've reached that 1,000 threshold and they're starting to damage their kidneys. Tylenol is the leading cause of adult liver failure. So even those simple over-the-counter painkillers that most people use on a fairly regular basis can cause some damage to the body. Then we get into the more powerful prescription drugs. They have a lot of side effects. You probably hear all the side effects at the end of the commercials, and especially the painkillers. A lot of them have addictive qualities, the opioid drugs, things like that. Thomas Edison actually said the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, that's what we're doing, in diet, and in the cause and prevention of disease. It's always best to prevent something than to try to treat it once it's already there. Now, I'm not saying all medicine is unnecessary. There's certainly a time and a place, but what most people think of as their first resort or first option should really be their last resort. We should always try to find that cause first of all. Now, if we were to take a cross-section of your entire spine and look at it on end, only about 3% of the nerves feel pain. That means the other 97% are doing something else. They're functional. They're not the ones that are sensing or feeling that pain. The rest of those nerves, you could go in there, you could actually pinch them, you could cut them, you could burn them. They wouldn't feel it. The motor nerves, the ones on blue on my chart here, are the ones that control your muscles. So if I want to walk over here, if I want to pick up my arm, my brain has to send a signal down my spine, travels at about 200 miles an hour, it goes out to that muscle, and then that muscle contracts. If that nerve is being pinched, it can lead to muscle weakness, spasms, fatigue, tightness, even paralysis if it gets pinched severely, right? Another 45% of your central nervous system is made up of autonomic nerves. These are going to be the most important ones in your spine because they're keeping you alive. They go to all of your organs, your blood vessels, things like that. So your heart, for example, it's beating, it's got autonomic nerves going to it, telling it how fast, how strong to beat. Lungs are breathing. Digestive system is a really big part of the autonomic nervous system. So when these get pinched, it can cause a lot of those types of issues, digestive issues, heart-related, organ-related, blood pressure issues, stuff like that. Your sensory nerves detect things like pain, 3% of them. The rest of them detect things like touch, temperature, blood pressure, stuff like that that your brain is constantly monitoring and then sending signals out to the rest of your body for. So we know from looking at a chart like this, since so few of the nerves actually feel pain, that feeling good doesn't necessarily equal good health. Good health is going to equal healthy function of all these things working together. Now, in a few minutes, we'll go over your x-rays with you if you've had x-rays, and we will show you what we found on there. But there are a few areas of the spine that we see out of alignment more often than others, especially right up here in the upper neck. That's called your atlas vertebrae, or C1. When that gets out of place, that can affect your overall health more dramatically than any other bone in your spine. It'll affect from the top of your head all the way down through your large intestines and everywhere in between. The reason for that is you've got this big nerve called the vagus nerve. It's green on my chart right here. It comes out right there at C1, and then it hits all of your major organs down to your large intestines, and it can affect all of those. C2 and C3 are going to be your headache bones. When those get out of alignment, it can cause a lot of headaches, tension headaches, migraine headaches, also sinus issues and the headaches associated with them. Dropping down here between the shoulder blades are the cardiopulmonary nerves. These nerves come out, they go directly to your heart and lungs. If they get irritated, it can cause increased blood pressure. It could cause decreased blood pressure if they get cut off. And then it can also cause a lot of breathing difficulties. It causes the bronchioles to constrict in the lungs and asthma. Then down here in the low back is the other area that we'll see out of place quite often. When these are out of alignment, it can cause low back pain for sure, and sciatica, which is pain down the backs of the legs, but also these nerves have to go to your organs of digestion, so your large intestines especially. See a lot of people with irritable bowel syndrome, chronic constipation, diarrhea when the low back's out of alignment. It's also going to affect the organs on down into the pelvis, the urinary tract, and then we see people with a lot of reproductive health issues when the low back's out of alignment too. So when we do look at your x-rays, most people realize you should be nice and straight when we look at you from the front or the back, like this. We don't want to see you tilting one way or the other or twisting one way or the other. But what a lot of people don't realize is when we look at you from the side, there are 3 curves that are supposed to be there. One in your neck, one in your mid-back, and then one down here in your low back. Those are your natural God-given shock absorbers. Every time you take a step, there's shock on your spine. If you were to like stumble off of a curb or have some sort of a car accident or other trauma, there's going to be a lot of shock on your spine. So normally those curves are there and they act like a spring to help absorb that shock. Unfortunately, most of us spend a good part of our day looking down, myself included. So we lose that natural curve there in our necks. And if we're seated a lot throughout the day, we can lose that curve down in our low back as well. So instead of dropping the ball onto a spring, it's more like dropping the ball onto a cement block. There's no shock absorption, and the discs in between the bones have to take up the brunt of the force, and they start to wear out. So what will happen is, over time, you get disc degeneration. This is a normal neck. Looking at it from the side, you may be surprised to know there's that much curve normally there. Should be about 40 to 60 degrees of arc. These are good, healthy-looking discs in between the bones, those dark areas. This neck has lost its natural curve, and so like dropping that ball onto the cement block, the discs have started to degenerate, spurs are starting to form in there. This can actually happen in the neck, and the low back is the other area that we'll see this quite a bit in. So it's really important to try to keep those natural curves as well as possible. So kind of a fun and easy way for you to think about that curve in your neck is being like the curve in a banana. If you were to straighten out a banana, it's not going to be very good for the inside part of that curve, right? That's where your spinal cord is, and then it's going to compress the outside part of the curve. That's where your discs are. So if we look at that on cross-section, you can see it would pull down on your brainstem, and then it's going to compress those discs right there. So that curve in your neck should be backwards like this. If you're looking down a lot, you're straightening out that banana. So always think about trying to keep that curve as good as possible, keeping your ear back over your shoulder and keeping that back in the normal position where it's supposed to be. One of the best things that most people can do for that is just a neck extension stretch. Now, I recommend doing this in a seated position so that you don't get dizzy, but just letting your head hang back as far as you feel comfortable and then counting to 10. Now, if this causes you any sharp pain or dizziness or anything like that, talk to us before you continue with it. But I recommend that most people do that at least 6 times throughout the day. 6 times for 10 seconds, that's going to take a minute out of your day. What that's going to do is help stretch out the ligaments and muscles in the front part of your neck and restore some of that curve so that you can hold your adjustments better. Some things that can cause subluxation are going to be different types of stress on your body. So some of these you should try to avoid. Some of them are going to be unavoidable, and they're things that can cause subluxation that our bodies have to cope with. But 3 different types of stress, or 3 different categories, can definitely cause subluxation. The first one I want to talk about is psychological or emotional stress. These are things that stress you out emotionally, mentally, things that can make you angry, scared, sad. Things like maybe family stress, work-related stress. I always like to think about this a little bit like driving in really bad traffic in the fog. What happens to these muscles up here when you're in a stressful, tense situation like that? They tend to get really tight, right? It pulls up your shoulders, can cause the bones to shift out of alignment right there between your shoulder blades, and then that can actually elevate heart rate, elevate blood pressure, rapid shallow breathing, things you would associate with a stress attack or a panic attack. So it's probably no big surprise to you to know that the better you deal with those emotional, psychological stresses, the healthier you're going to be, but you may be surprised to know the healthier your spine is going to be as well. The other 2 forms of stress are a little bit more tangible things you can try to avoid. Chemical and biological stresses. These are things that come from outside in, things like smoking. They've actually done studies and autopsies on people who smoked, and they found that the nerves coming back from their lungs cause the muscles to pull the bones out of alignment right there between their shoulder blades. Same thing with people that take a lot of medications, use drugs. It's going to cause the nerves coming back from the kidneys and liver to affect the spine. And then alcohol is going to affect the nerves coming back from your liver. Air pollution. Now this is one that's pretty tough to avoid, and unfortunately we have poor air quality here in East Tennessee. We're stuck between the Cumberland Mountains and the Smokies, and everything collects down here in the valley. But one of the really cool things about our bodies is that they're very adaptable to their surroundings. Your brain is constantly monitoring what's going on with your body and then sending signals down your spine to adapt to it. So whether it be air pollution, water pollution, chemicals in the foods that we eat. Now, I don't think any of us are drinking brown sewer water, but even city water has over 350 chemicals in it our body has to deal with. And then, the foods that we eat, it's got antibiotics, preservatives, chemicals, things like that. So our bodies have to deal with those. Viruses, bacteria, these things are around us all the time. They're in this room right now. But our bodies are able to normally fight these things off. We have immune systems that can detect them and destroy them. Your immune system is under direct control of your central nervous system as well, your brain and spinal cord, and so it coordinates that response. One of the really cool things that our practice members always tell us that have been coming in regularly for a couple of years is they always say, you know what, I don't get sick nearly as often as I used to. I can definitely tell you that's true for myself. Before I began life as a chiropractic patient back in 1997, I was 23 years old at the time, and before that I would always get bronchitis a couple times a year. I'd take antibiotics for it. I would get the flu at least once a year. Since then, since I started chiropractic care, I haven't had those things at all. I haven't had an antibiotic since before 1997. Our son's the same way. He was born in 2007, and he's been adjusted since the very first minute he was born. And it wasn't for pain or anything like that. It was just to keep him healthy. We wanted to make sure that he had a healthy nervous system and would develop properly. And same thing with his immunity. He's never had ear infections, never had strep throat, all those common childhood illnesses, never had those things. If he does get sick, his immune system kicks in right away. He's able to get over it very quickly. Physical stress on the body is the biggest cause of subluxation. We all had a big physical stress when we were first born. I just mentioned that our son was adjusted from the very first minute he was born. He was born at home, so I was able to adjust him very quickly. And it wasn't because of like a real traumatic birth or anything like that. We just wanted to make sure that things were working properly. Even with a normal delivery, there's a lot of pressure on a little baby's neck, right? And then there can be even more trauma with things like a forceps delivery or vacuum extraction, C-section, stuff like that. With a C-section, a lot of times people think, well, there's no trauma on the baby's neck, but I've seen videos of them where the baby comes out sideways and their head's flopping side to side. So it's really important for babies to be checked out. If you were never checked out as an infant by a chiropractor, then those problems can grow, those problems with the spine can grow and manifest and become bigger problems later on in life. Other forms of physical stress are going to be sleeping in the wrong position. We'll talk more about this one in a few minutes. This is a really important time, though, is when you're asleep, because this is when your body has a chance to rest and repair. Accidents, traumas, not just car accidents, but sports injuries, slips, falls, stuff like that. Improper lifting. Always make sure you're lifting with the big muscles in your legs. Never lift and twist at the same time. That's when you're most likely to damage one of those discs in your spine. Let's get into a little more detail on some things that you can start doing. First of all, I'll talk about seated posture. You're probably seated right now, so this is something that you can do with me. Think about keeping everything symmetrical. You want your eyes level with the horizon, your shoulders, and your hips. So what that means is don't sit on a wallet or cell phone or anything like that that's going to tilt you to one side or the other. Make sure that if you cross your legs, it's below the knee only. If you cross above the knee, that puts a twist in your pelvis. And then if someone were looking at you from the side, you want your ear lined up with your shoulder and your shoulder lined up with your hip. Most people tend to go forward with their head, and then the weight of their head over time pulls them more and more forward. So I want to try to keep that back, keep that curve in the banana. Same thing's true with standing posture, keeping everything nice and symmetrical. So that means if you're carrying a heavy purse or maybe a backpack on one shoulder, baby carriers, toolboxes, briefcases, anything like that, it's going to pull you off to one side. It's best to have a backpack with 2 straps on it so that you can keep that weight level, or the second best is going to be some kind of strap that goes diagonal across your spine and helps to distribute that weight. Sleeping position, again, is going to be super important. Always try to avoid sleeping on your stomach. The reason why is it puts a pinch in your low back, and then you have to turn your head one way or the other in order to breathe. So it puts a twist in your neck. It's best if you can either sleep on your side or on your back. If you're on your side, you want to have just a thick enough pillow to support your head. Too thick, it's going to be up like this. Too thin, it's going to drop down like that. And then put a pillow between your knees. What that does is keeps you from crossing your top leg over your bottom. That would be like sleeping with your legs crossed or sitting with your legs crossed, and that's going to put a twist down there in your low back. Then if someone were looking down at you from the ceiling, think about keeping your ear, your shoulder, and your hip in a nice straight line. A lot of people tend to curl up into a ball or pull one leg up, not the other one, and just get all twisted up when they're on their side. It's not on my picture here, but I also recommend hugging a pillow with your arms. That does a couple things. If you have numbness and tingling in your arms, it'll help to open up the shoulder joints. Also, it'll prop you up and keep you from twisting and rolling over onto your belly. If you sleep on your back, just a thick enough pillow to support your head and neck, and then one underneath your knees. If you have low back issues, that'll take some of the pressure off of your low back. Again, not on my picture, but if you have numbness and tingling in your arms, put a pillow on your belly or chest and kind of hug that. That'll open up those shoulder joints and the lower part of your neck. Be careful about falling asleep, reading in bed, watching TV with too many pillows or an overstuffed pillow. When you're at work, if you are working at a computer or whatever you're doing at a desk, make sure that you're nice and straight in that position. It's best to have a computer screen at eye level or a little bit higher and then straight in front of you so that you're not having to turn one way or the other to look at it. Really important with handheld devices. They're becoming more and more prevalent in everyday use, especially at work. And with things like texting and text neck, that's actually become a term now in the medical textbooks. Things like tension headaches, neck and shoulder pain, difficulty breathing. Really important with children because this is the time when their spines are developing their curves. So we tell our son if he wants to play on a device like this that he can get down on his stomach. This is one time he can get on his belly, maybe on a blanket, prop himself up on his elbows, and then have his head in extension rather than looking down at that thing. And then limiting time on those electronics to maybe 10, 15 minutes at a time. Other causes of subluxation, a lot of times people will look at their x-rays and they'll be like, oh, gosh, doc, how did I end up this way? Why does my spine look the way it does? Well, your spine looks the way it does today because of all of the stresses on it, all of the things that have been done to it, all the corrections that have been done to it over your entire lifetime. So especially as children, we're always doing things that kind of mess up our spines. Again, that's why we like to check kids out. And usually kids don't have chronic aches and pains. So you may not know if there's a problem developing in there. I've never had a 5-year-old come in and be like, oh gosh, doc, my sciatica is killing me today. They're just not like that. They may cry for a few minutes, but then they normally bounce right back like this guy here. So it is important to be checked out as a child. If those problems aren't corrected as children, they can become bigger problems than as adults. So things we do growing up, even fun things like sports, can definitely knock the spine out of alignment. Football's a big one, but other big sports injuries that we see are going to be from gymnastics, cheerleading. Soccer is a big one, especially on the neck. Any type of running sport is a big one for the low back. Work-related injuries, and a lot of times people think, oh, work-related injury, I must have fallen off of a ladder or had, been run over by a forklift or something like that. That doesn't necessarily have to happen. Repetitive motion type injuries at work are the most common types of work injuries. So people who are on phones all the time, on the computer a lot, it usually messes up their shoulder and their neck from having their hand out like this with the mouse. And then the types of jobs where you're doing the same thing over and over, maybe assembly line work, stuff like that. Those are all types of work stresses. I already talked about weight distribution, trying to keep things lined up as well as possible there. Our weekend warriors just getting out, damaging their spines. One-sided sporting activities, things like bowling, where you've got a big old heavy ball on one side of the body. Golf uses muscles more on one side. You're always twisting to the same side. Tennis, baseball, softball, same thing. You're using one side of your body more than the other, so that tends to pull the bones out of alignment. Just to jump back to infants real quickly, a lot of times people are kind of interested as to what we do with an infant, how we know if they need to be adjusted. Most of the infants that come into our office are coming in because, just like our son, their parents want to keep them healthy. They don't really have, aches, pains, things like that. Maybe no symptoms at all, but they just want to keep their nervous system working and let them develop properly. But a few warning signs to look out for with an infant is maybe pulling on their ear could indicate that they're having some ear infections. That's something we can definitely help with. A lot of colic, gastric reflux. Once they start crawling, they may have one limb that doesn't move as well as the others. Those are all things that can be helped with very gentle chiropractic adjustments. When we adjust an infant, we typically just need to use our pinky and wiggle that top bone into place. It doesn't take much pressure. We don't have to use as much force as we would with an adult. We don't x-ray infants unless they've had some sort of a severe trauma. We don't need to x-ray them. We can feel their spine and determine where those bones are out of alignment. So a really easy way for you to describe chiropractic to your friends, your family, they may ask you, hey, what did you learn at the chiropractor? Is describe your spine being like a garden hose. If you were to put a kink anywhere along the length of a garden hose, it's going to cut off that flow of water, and that grass is going to wither away and it's going to die. Doesn't matter if the kink's at the end of the hose, in the middle, or up by the house, right? You're going to get that same effect at the end. Same thing's true with your spine. You could have a pinch up here, in the middle, or down here. It could affect anywhere below that point. So I've actually had people come in with leg pain, foot pain. Their problem has been way up here at their neck. Now, it doesn't take much pressure on the spine to affect it adversely. The weight of a dime is enough pressure to cut off 60% of your nerve's communication. The weight of a quarter can cut off 100%. So when you get a hard bone pinching on a soft nerve, that's not going to be a good situation. Now, if I were to take one of these bones and pull it out and look at it on end, right there where my thumb is how much space your spinal cord has to pass through. So if this bone moves forward or backward or side to side or tilts or twists, that's going to cause a subluxation. On my model, these nerves are made out of rubber, but in you and me, your nerves are about the consistency of Jell-O. So very, very soft. Doesn't take a whole lot on there. Our job is to figure out where those subluxations are, remove them, and then just like that grass gets green again, your body's able to start functioning again. Now that does take time. It takes repetition for that to happen. It's kind of like melting an iceberg. If you think of the whole subluxation being like an iceberg, pain symptoms are just the tip of it, but we want to get rid of that big part that's under the surface that you can't see, that subluxation. The reason that I say there's a much larger underlying cause is because on average, according to the American Orthopedic Association, an American with spinal pain has had a problem for 10 years with their spine before their first symptom even shows up. So the symptoms are just the tip of the iceberg. Now, it does take a long time to build an iceberg, right? To form one, it's going to take some time to melt it also. And just like what I was talking about earlier with the fire alarm, if we just try to mask those symptoms, that sends us on this downward spiral of having to take stronger prescriptions, medications, shots, surgery, and still hasn't taken care of the problem. It's just masking those symptoms. So we always want to get to the cause of that, melt that iceberg. But that is going to take some time. It's a lot like wearing braces on your teeth. On average, for a person who goes into the orthodontist with crooked teeth, they have to wear braces for 2 to 4 years to move the teeth just a few millimeters. With the spine, sometimes it can be out of place a couple of inches. I've never seen anybody with that big of a gap in their teeth, right? That'd be clear across your whole mouth. So it's going to take some time to get things back to where they need to be. Now, if you went into the orthodontist and you're supposed to wear your braces for 4 years, but you took them off after a year or two, guess what? Your teeth aren't going to straighten out. They're going to move back to where they were. If you do follow your correct plan and you follow the program, a lot of times the orthodontist is going to recommend that you wear a retainer, maybe while you sleep at night or on weekends. If you don't do that properly, guess what? Your teeth are going to move back out of alignment. So we always recommend complete corrective care for our practice members, and then we follow that up with wellness care to keep things lined up the way they're supposed to be. So if you follow your adjustment schedule, things will start lining up. But if we discontinue that care too soon, the muscles, the ligaments, they're going to pull the bones back out of alignment. Things are going to shift back out of place. Now, it does take some time. It takes repetition to get bones back to where they need to be and off of the nerves. On average, we find it takes about 1 to 3 years to correct an adult spine. When I say correction, I mean getting the pressure off of those nerves. Now, 1 to 3 years is a long time, but remember, 2 to 4 years for correcting teeth. And your spine's a heck of a lot more important than your teeth, right? You can live with crooked teeth. You can live without teeth. You can get false teeth if you need to. You can't get a false spine. It's the only one you're going to have. So we got to make sure we take really good care of it. A couple of questions I'll get about this sometimes are, could you just take a baseball bat and whack me a few times and knock that spine back into place? No, I don't think you would like me very well if I did that. That would be painful for one thing. So what we need to do instead are more gentle adjustments over a longer period of time with lots of repetition. Typically, we'll use our hands. Sometimes we may use an instrument that has a little spring inside there and taps the bone back into place. The important part, you can kind of communicate with us as to what your preference is on adjusting technique, but the important part is to get the pressure off of those nerves so that things can start functioning again. The other question I'll get a lot of times is, well, could I just come in like every day of the week and do that for a month or two and then I'd be all set and never need to be adjusted again? Well, yeah, you would probably feel a lot better if you did that for a month or two, but it would be like going home and brushing your teeth for 3 hours before you go to bed tonight. You're going to have really clean teeth, but what are you going to have to do again tomorrow and the day after that, and next week and next month? If you want to maintain clean teeth, you're going to have to continue to brush them forever, right? As long as you want to maintain those clean teeth. Same thing's true with your spine. Unfortunately, we're all going to have those stresses that continue to pull us back out of alignment. Even if you don't have any emotional or physical stress on your body or chemical, you've got gravity pulling down on you that's going to try to pull things out of place. So your spine is something that we just need to take care of and keep it lined up just like you would taking care of your teeth or anything else that you want to maintain. So the road to recovery can have some peaks and valleys. When you first start chiropractic care, it can be a bit of an uphill climb. I tell people that because sometimes they may get a little bit more sore with their first couple of adjustments, kind of like getting those braces first put on, or maybe starting a new weightlifting program or workout program. You're moving things that haven't moved in a while. But that usually only lasts a week or two, and then you're going to start to progress. So if you started with your health down here, I don't really expect you to go from here straight up. What normally happens is it's kind of a wavy road, peaks and valleys, peaks and valleys. You may get a little better, get a little worse, get a little better, get a little worse. But guess what? 6 months from now, we want to see you a lot better than what you are today. 12 months from now, much better, a couple years from now. So that gradual progression of getting better and better health. Now, guess what the average American says happens to their health after they pass the age of 30? Think it gets better or worse? Yeah, it gets worse. 30 is the age where Americans say their health starts to go downhill. Our practice numbers are the opposite. We've actually had people improve with their health in their 80s and 90s starting chiropractic care. And I'll tell you about one fellow in particular. He was 92 when he first came in for his first chiropractic adjustment. His son had to drive him to his appointments because he couldn't look around him because he was stuck using a walker and just looking down at his feet, basically. After about 6 months of chiropractic care, he was able to start driving himself to his appointments again. He was using a cane rather than a walker, much more upright, able to look around him and be able to drive. So as a 92-year-old, he was pretty excited about that. By the time he was 94, he was able to, he was continuing his chiropractic care. He was able to get off a lot of his heart medications, his liver medications, his blood pressure was better. So there is room for improvement at almost any age. However, I will say the younger your spine is, the faster it's going to respond and the more resilient it is as well. So don't wait. Take care of your spine as soon as possible. Now, I will warn you, sometimes you get up to that pain-free plateau. You don't have that smoke alarm going off in the back of your head anymore telling you to take care of your spine. And so people kind of quit and they spiral back downhill. And then we'll see them back in our office usually about 6 to 12 months later. They have the same issues and then we got to start over again. When that happens, for some reason, it's a lot more difficult to get them back to that pain-free stage in most cases. So if you do get up to this pain-free plateau, I recommend that you just progress a little bit further up there to the top of that mountain, and then it's a nice flat road of recovery once you're up there. So it's a lot easier keeping a healthy spine healthy than it is trying to correct a diseased, rotten, worn-out spine. That's why we love getting children in the office. They usually start at this level. They don't have very far that they have to progress to get up there to that recovery. So Einstein said you cannot resolve a problem with the same level of thinking that existed when the problem was created. We're looking at things a little bit differently. We're not medical doctors, so we're not going to give you medications from outside in that change your body chemistry or try to mask things. We're looking at things from inside out, trying to correct things that way. We're different from a lot of other chiropractors. We actually have practice members that drive here on a weekly basis from Kentucky, from Crossville, from Sevierville, hundreds of miles past hundreds of other chiropractors to come to Little Old Carnes. And the reason is really simple. We specialize in the chiropractic adjustment. That's the only thing we do here at our office is remove that interference so that your body and brain can function the way that God intended them to. That being said, we're not going to try to sell you nutritional supplements. We're not going to hook you up to stretching machines or electric shock or things like that. There's a time and a place for those things, but if you need that, we'll refer you to somebody that specializes in that. Our main point, our main emphasis is to remove that subluxation so that your spine can start functioning properly again. A couple of things that leads to in our office is, number one, this is really going to be the last long appointment you have for quite a while. Normally you can come in, get adjusted, and be on your way in about 10 to 15 minutes. It doesn't take that long to adjust the spine back into alignment. Number two, it allows us to keep our fees really reasonable. We have affordable plans for people with insurance, people without insurance, family discount type plans, things like that, and we'll go over that with you here in just a few minutes. A couple other things we do to keep your time down to a minimum here at the office. We know your time is important, and also keep your fees low, is we really don't have people coming in and like paying every time they're coming in here, paying per visit or paying a copay each time. If we did that, it would cause us to have to hire an extra person just to process those payments. It would take a lot of extra time. So what we'll have instead are a couple of different options for you. Sometimes people will want to do like twice a month payments, monthly payments. Some people will even want to do just once a year and take care of that. Now I will say it's not a membership. It's not like joining a gym. It's not a contract. You're just paying for what you use, and it's a more simple way for us to keep track of that. So just to conclude, I have a couple pictures. This is a 1973 Mustang. I picked that out. It's the year I was born. Hopefully I'm doing better than what this car is. This car in particular, I don't think its owner is going to get much use out of it, right? It has not been taken care of. I don't even think it has an engine. This is the same year car, also a 1973 Mustang. Been taken a lot better care of, right? Restored, maintained. Anything that you want to last a long time, you got to take proper care of it, whether it be the roof on your house, your car, or in our case today, your spine. Difference between your car and your spine, though, is you can replace parts on your car fairly easily. You can replace your whole car if you have to. Can't replace your spine. It's the only one you're going to have. I don't think there's going to be anything such as a spinal replacement surgery in any of our lifetimes, so we have to take care of it so that it can last us the rest of our lives. Last time I was in Florida, I saw an elderly couple walking hand in hand down the beach, and they were having a good time, enjoying life. And I thought, you know what? I want to be like that when I'm that age. I don't want to be sick and dying in a nursing home. Who does, right? One of the coolest things about chiropractic is that not only does it add years to your life, but more importantly, it adds life to those years so that you can do the things that you want to do later on. Maybe have grandkids someday that you want to be able to spend time with. Sporting activities. We have a lot of seniors that are really into softball, golf, things like that. And then community service projects, so helping out with your community, your church, doing stuff like that as well. So one last thing to consider. Who needs to have their spine checked? Just people who are in pain? No, not really, right? Because only 3% of those nerves even feel pain. That means 97% of the time there could be a subluxation with something else going on, and that person may not even feel it. That's why we do the NASA scans. That's why we do x-rays and examinations, so we can figure out exactly where those problems are beyond where those nerves just are causing pain. So if you know of anybody that wants to get checked out, we can check them out here in our office. You may know friends, family, and other parts of the country that you think would benefit from chiropractic care. Let us know. We'll try to find them a chiropractor as well. So we really, really appreciate you choosing chiropractic, choosing our office, and we look forward to working with you.
So I hope you learned some incredible information from the doctor's report. It's amazing to me how the body works, and when the nerves are functioning properly, your body's going to function much, much better. And your body has the ability to heal itself. So I know that's something that we don't hear a lot on TV and, you know, the drug commercials and all those things that you listen to every single day. But your body can heal as long as there's proper communication. Our motto in our office is that we move the bone, God does the healing. God created the body with the ability to heal as long as that communication's there. So we're really excited for you to get started with chiropractic care, and we'll be in just a few minutes to go over your findings.